My name is Dr. J. Kilpatrick, and I work at Baystate Medical Center, and I'm the director of the Psychiatry Consultation Services here. So this was my first time being involved in the CARE program, and it was a very positive experience. I think like most providers, when they learn they may be involved in a program, there may be some anxiety involved. And I think that's pretty normal. But as you get to learn more about the program and its purpose, that anxiety ultimately dissipates. And there's tremendous potential to have it be a positive experience for both the provider and the families involved. One of the aspects of the CARE meetings that I think could be universal are that there may be very strong feelings, emotions, and affect, certainly that may come from the family. And I think that may be something that providers may get anxious when thinking about, or there may be some fear around that. What I realize is the strong feelings in the room that you may see in the meeting are actually an opportunity to engage further with the family. And while your body may be saying to lean back, what you actually want to do in those moments is lean in. And you want to explore that more with the family. And the family may often open with that. And this is what occurred in the meeting I participated in. And what you can do in those moments is invite them to say more. You can validate the feelings. It sounds like your family has been going through so much. Can you help us understand what you've been going through more? And it gives them a chance to get that out. And it also proves to them that you are listening and that you are curious about what they've been going through, and that you want to understand it and empathize with them. And that is a really good way to form an alliance in the meeting with the family. That ended up being a really nice approach because they told us more. And when they were done, you could see a change in the room. They had the opportunity to get that out. And then once that happens and they're able to think more, they're able to be a little more cognitive. So you move them from a place of high emotions to a place where they can think more and ask their questions. That is when the opportunity is there to help explain what happened from a medical standpoint, mental health standpoint. And then everyone is talking, okay? And I think that is sort of the goal of many of these meetings. They won't all go like that, but I think it's the goal of many of these meetings to move the family from a place of either high emotions or high cognition back to the middle. And then conversations can occur. As providers, we are often heartbroken when an outcome is undesirable. It could be a loss of life, a change in a mental status for a patient. And for the people sitting across from you, it's their family member, their loved one. There is actually typically shared loss in the room. Now, obviously, we want to keep the families at the forefront of the discussion. But I think what providers may not realize is that they may be suffering too. And there may be an opportunity for healing between the family and the provider. One way to do that is actually to ask the family, after you've spoken to them for a little bit, we only saw your family member in the hospital. Can you tell me, what were they like outside of the hospital? You know, what did they like to do? What did they enjoy? What were their hobbies? We had a moment like that in our CARE meeting, and the families really lit up. And we got to hear about the patients, what brought them joy and their hobbies, and we got to share that. And it was really a moment of healing for I think both parties involved. That's another nice way to make a connection. I'd recommend it, asking more, telling them we only got to see them when they were sick. what were they like when they were feeling better? What did they enjoy? What did they like to do? And another thing we can do is ask about family members who aren't in the room. If there were extended family you knew that were involved too, and were maybe visiting or whatnot, I would invite the providers to ask on how the extended family are doing too. The families involved, I think, would really appreciate that. And it's another way to form an alliance with them. But make no mistake about it, both parties are definitely suffering in this moment. It's our job to answer questions for the family. We can do that compassionately and empathically. And it's okay to acknowledge that this is very hard on the providers too, and that they're going through something as well. And that is I think that's some of the magic that comes out of the care meeting, is that the provider can actually leave the meeting feeling better. Even though there's been a loss of life or a tragic event, there can be a lot of healing that goes on for both parties in this meeting. There will certainly be times in a care meeting where a family may be so upset or distraught that they are in that moment inconsolable. It is okay to pause the meeting. It is okay to say, I want to figure out the best way that I can help you right now. But there are a lot of feelings in the room right now, and that's okay. That's why we're here. And I'd recommend we take a short break and come back. This way I have some time to think, and we can come back to the table and discuss this more. You can thank them for expressing how they're feeling. Tell them I need to take a break for a moment because I need to figure out how best to help you. And when voices are raised, it is hard for me to think in that moment. And if I can't think, I can't help you. And that's why we're here. You can also posture that question to them. I can tell how upset you are. I can see that you're suffering and that you're having trouble even engaging in conversation with us. Please help me understand how best I can help you right now. Tell me what you need right now in this meeting, and we will do whatever we can to meet that need. It's okay to pause to do that. Give them a break, water, food. These are wonderful gestures, if possible, to have at the meeting. But it is okay to pause and regroup and come back. In fact, it's healthy. And they may need a break too if they've just let go of a tremendous amount of feelings. So the things that may make you very fearful of the meeting are actually the opportunities and the tools to have the meeting go really well. If you have a lot of feelings in the meeting, it's a good thing. It means the meeting's probably going to go well. You just have to lean into them. Allow the family to go through that. Be curious with them. Invite them to express more. Then you can get to the questions, the nuanced medical piece. The facts of the case can be difficult for families to understand, even the most sophisticated ones, which was the case with the care case that I was involved with. One thing you can do is take a position of curiosity and invite the family to identify their needs. And in this scenario, that may very specifically be, help me understand very specifically what question you need answered. And you may have to do that one question at a time. Check back in with them after you answer. Did what I say make sense? We're explaining a very complicated procedure, or we're explaining a very complicated laboratory panel, okay? And a cascade of events that brought us here, okay? So continue to be curious, continue to check in for these very specific, detailed-oriented questions, and reflect back. I see you nodding your head. Did you understand? Do you feel like you understand? Do you feel like I answered the question in a way that is understandable? Did you feel like I answered the question in a way so that now you have a better sense of what happened specifically? Take that position of curiosity and continue to ask if you were able to answer the question. And what you're actually doing is encouraging the family to get their needs met. And that is really key in helping them to feel heard during the meeting and feel like they're getting the information they need. Chances are, if you're really sort of enmeshed in the discussion, you may feel a little tired after. But it's one of those tired's where you know you did the right thing. And you did the right thing for yourself, for the patient, for the family most importantly, and even Baystate Medical Center. One of the benefits of having a meeting like this was it provided some closure to the case. Now that may not be true for every case, and there may be some cases that continue afterwards. But as a provider, I knew without the program, there would have been this event and it would have been out there, and I would have never really had closure with it or a connection with the family and had or gained any sort of meaning to the event. And this program allows for communication. It allows for healing to occur. It allows for a process to get feelings out. And ultimately, I think it allows for some closure, potentially for the family and the provider.